A very good morning to one and all. What do we do if a patient presents with severe blepharoptosis with poor levator function and we want to correct it with autogenous tissue with prolonged effect? Yes, you can either go for a frontalis sling with fascia lata or frontalis flap. What is already known, postoperatively, there should be good symmetry in the eyelid height, there should be a good eyelid contour so that the patient is happy, and there should be minimal postoperative lag of thalamus. While most existing studies limit their outcome measures to only eyelid height and lag of thalamus, eyelid contour symmetry with the fellow eyes is vital to the aesthetic appearance of the face. So this led us to compare the outcome of frontalis sling with autogenous fascia lata and frontalis flap surgery in blepharoptosis patients using image J based objective measurements. This was essentially a retrospective review of 41 patients in a decade between 2014 to 2024 done at the LV Prasad Eye Institute, Bhubaneswar. We included 17 normal volunteers representative of all age and gender with no obvious eye asymmetry or eye surgery. So we had 24 patients who had undergone surgery grouped into group A, who comprised 10 patients who underwent fascia lata, and group B, who comprised 14 patients who underwent frontalis flap surgery. All measurements were objectively derived using the image J software. The primary outcome measure was MRD1, the secondary outcome measure was lag of thalamus, and inter-eye nasal by temporal ratio. Now what do I mean by that? A digital protractor was superimposed on the standard clinical photograph of eye of the patient. An x-axis or a horizontal axis passing through the lateral canthus, and y-axis was passing through the MRD1 or the 90-degree superior limbus. So there was a common central point. From there, at 15-degree intervals, the rays were passed through the upper eyelid to find out the contour of the eyelid. Moving on to the demography, showed that there was a slight male preponderance. The normal volunteers had a mean age of 23.7. The fascia lata group had 17.4 as the mean age, and frontalis flap had 34.7 as the mean age. Both the groups showed significant and comparable improvement in MRD1 post-surgery. Moving on to the contour symmetry. So you can see here that we had actually compared the inter-eye nasal ratio and the inter-eye temporal ratio. We had plotted it on a map. The blue color here shows the mean of the inter-eye nasal ratio, which was plotted for normal, fascia lata and frontalis flap group, while the black line showed the mean of inter-eye nasal ratio, temporal ratio for all the three groups. So it was seen that though the mean was comparable, in the post-operative group, there was a large variation. Lag of thalamus was worse in the frontalis flap in contrast to literature, and revision surgeries was more commonly performed in fascia lata group. So there were a previous few studies which had objectively, mathematically, compared the temporal by nasal ratio and the eyelid contour using mathematical third-degree equations for diseases like Graves' disease and congenital blepharoptosis, though nobody had compared the eyelid symmetry post-surgery for the two most commonly performed surgeries like fascia lata sling and frontalis flap. Though our study was retrospective in design, had a smaller sample size, and assumed that the horizontal corneal diameter was 11.5 millimeters, our study was one of its kind. It objectively measured the eyelid height and contour with image J. It compared eyelid symmetry with normal volunteers, thereby reducing subjective bias in the outcome. Frontalis flap gave comparable height and contour as compared to fascia lata as studied in our group. Lag of thalamus was seen more in frontalis flap group in our study. I thank you so much for your patient listening.
Statistical method you used here?
So we had used image J to objectively find out the measurements, and the statistical, this thing used was T, the student's T test. So image J is basically a Java-based image processing program which helps us to find out the measurements easily. So this was basically an objective measurement to find out the MRD1 and the contour symmetry between both the eyes.
My question is that you compare with the normal volunteer or you compare
No, inter-eye, madam. Inter-eye, symmetry.
Of same person?
Yeah.
Okay.
Yeah. Because the patients were bothered about the symmetry post-surgery.
So to be clear, the normal volunteer you said you just compared with the other of the
Yeah,
same
we
person.
wanted age matched and sex matched
Okay.
control, so we included a few of them.
Fine.
Thank you.